In today's complex healthcare landscape, every detail matters, especially when it comes to how hospitals are paid. Getting paid correctly starts with something called patient grouping. This is the process where hospitals categorize each patient based on their diagnosis, the procedures they received, and other important factors. This grouping determines how much a hospital will be reimbursed by insurance companies and government programs like Medicare. Accuracy here is not just a goal, it is an absolute necessity. If a patient is placed in the wrong group, the hospital might not receive the full payment it deserves for the care it provided, leading to significant financial shortfalls over time. The financial implications of inaccurate grouping are substantial. A single mistake can result in thousands of dollars in lost revenue for just one patient. When these small errors are repeated across hundreds or even thousands of patients each year, the financial health of the entire hospital is put at risk. This isn't just about money, though. It's about a hospital's ability to continue providing high-quality care to its community. Without fair and accurate reimbursement, a hospital may struggle to invest in new medical technology, maintain its facilities, or even keep enough staff on hand to care for patients safely and effectively. Beyond the direct financial impact, proper patient grouping is also a matter of compliance. Healthcare is one of the most heavily regulated industries in the world. Government agencies and insurance payers have strict rules about how patient data must be reported. Incorrect grouping can lead to audits, which are time-consuming and stressful for hospital staff. If auditors find patterns of errors, they can impose heavy fines and penalties. In some cases, repeated mistakes could even jeopardize a hospital's accreditation or its contracts with major insurance providers, creating a crisis that goes far beyond simple billing issues. Therefore, the need for a precise and reliable system for patient grouping cannot be overstated. Hospitals are not just processing paperwork. They are creating the official record of the care they delivered. This record must be flawless to ensure financial stability and regulatory compliance. It forms the foundation upon which a hospital's entire revenue cycle is built. In this high-stakes environment, relying on guesswork or outdated tools is a risk that modern hospitals simply cannot afford to take. The right software is essential to navigate these challenges successfully and protect the hospital's mission. To understand why precision is so important, we first need to understand the system itself, APR-DRG. This stands for All Patient Refined Diagnosis Related Groups. It is a sophisticated patient classification system used to group patients with similar clinical characteristics. Think of it as a way to organize patients into categories that reflect not just what brought them to the hospital, but also how sick they truly are. This system was designed to provide a much more detailed and fair picture of a patient's condition compared to older, simpler methods that often missed important details about a patient's health. The real power of the APR-DRG system lies in its two key components: severity of illness, or SOI, and risk of mortality, or ROM. Severity of illness measures how sick a patient is, taking into account all of their coexisting conditions or complications. For example, two patients might come in for pneumonia, but one might also have diabetes and heart failure. The APR-DRG system recognizes this difference and classifies the sicker patient into a higher severity level. This is crucial because a sicker patient requires more resources, a longer hospital stay, and more intensive care from doctors and nurses. Similarly, risk of mortality assesses a patient's likelihood of dying. This is another critical factor that reflects the complexity and intensity of care required. A patient with a high risk of mortality needs constant monitoring and may require advanced life support measures. By including both SOI and ROM, the APR-DRG system creates a much more nuanced and accurate picture of the patient population. It moves beyond a one-size-fits-all approach and acknowledges that patients with the same primary diagnosis can have vastly different care needs, which directly impacts the cost of their treatment. This level of detail is why APR-DRG is considered a superior system. It allows for fairer payments because it ties reimbursement directly to the complexity of the patient's case and the resources used. Hospitals that treat sicker patients receive higher reimbursement, which is a fair reflection of the work they do. This system also helps hospitals track their performance and patient outcomes more effectively. By understanding the severity of their patient population, hospitals can better manage resources, improve quality of care, and ensure they are equipped to handle the most challenging medical cases. While the APR-DRG system is powerful, it is only as good as the software tool used to apply it. Many hospitals unfortunately struggle with outdated or inadequate APR-DRG groupers, which leads to a host of problems that undermine the very purpose of the system. One of the most common issues is the use of incomplete code sets. The world of medicine is constantly evolving, with new diagnoses and procedures being added all the time. If a hospital's software isn't regularly updated with the latest codes, coders may be unable to accurately capture a patient's full condition, leading to incorrect grouping and underpayment. Another significant problem is the lack of built-in error checking. A basic grouper tool might simply assign an APR-DRG without validating the information it was given. This means errors in the original data, such as a mismatch between a patient's age and a diagnosis, can go completely unnoticed. For example, a diagnosis that is only applicable to adults might be accidentally assigned to a newborn. Without an intelligent system to flag these kinds of mistakes, incorrect claims are sent to payers. These claims are often rejected, forcing the hospital's billing staff to spend valuable time and effort on corrections and appeals. Integration with existing hospital systems is another major hurdle. Many older APR-DRG tools are standalone applications that do not fit well with modern electronic health record systems. This lack of seamless integration creates clumsy workflows, forcing staff to manually enter data in multiple places. This not only wastes time, but also dramatically increases the risk of human error. Every time data is retyped, there is a chance for a mistake to be introduced. Poor software integration can turn what should be a smooth, automated process into a slow and error-prone administrative nightmare for the hospital. Finally, outdated logic within the software itself can cause significant issues. The official rules and logic for APR-DRG grouping are updated annually by regulatory bodies. If a hospital's grouper is not using the most current version of this logic, it will consistently produce incorrect results. This is like trying to navigate a new city with an old map. You are bound to get lost. Using a tool with outdated logic means the hospital is not compliant with current regulations, which can lead to failed audits, financial penalties, and a reputation for inaccurate billing, all of which damage the hospital's standing. This is where a modern, sophisticated tool like Micro-Dyn's APR-DRG Active DLL becomes the gold standard for hospitals. It directly addresses and solves the common problems that plague outdated systems. First and foremost, it utilizes a complete and current code set, ensuring that coders have access to every possible diagnosis and procedure code. This completeness allows them to paint a full and accurate picture of each patient's journey, capturing all complexities and comorbidities. This precision ensures that the assigned APR-DRG truly reflects the level of care provided, paving the way for fair and accurate reimbursement from payers. One of the most powerful features of the Micro-Dyn solution is its built-in validation engine, which is compliant with the Medicare Code Editor. This acts as a smart safety net, catching errors before a claim is ever created. The software automatically checks for inconsistencies, such as age or sex conflicts with diagnoses, and flags them for review. This proactive error detection is a game changer for hospitals. It prevents incorrect claims from being sent out, which dramatically reduces the number of rejections and denials. This saves the billing department countless hours of rework and accelerates the hospital's revenue cycle significantly. Furthermore, Micro-Dyn's APR-DRG Active DLL is designed for easy integration with modern computer systems. It is not a clunky, standalone program, but a dynamic link library that can be seamlessly embedded within a hospital's existing health information system. This means it works behind the scenes, providing real-time grouping and validation without disrupting the user's workflow. Data flows automatically from the patient record to the grouper, eliminating the need for manual data entry and minimizing the risk of human error. This smooth integration makes the entire process faster, more efficient, and far more reliable. In summary, choosing the right APR-DRG tool is one of the most important decisions a hospital can make for its financial health and operational efficiency. By providing complete code sets, powerful built-in validation, and seamless integration, Micro-Dyn's APR-DRG Active DLL sets the gold standard. It empowers hospitals to get paid fairly for the essential work they do, maintain compliance with ever-changing regulations, and operate more effectively. In an era where every dollar counts, investing in a smart, reliable, and precise tool like this is not just a good idea. It is essential for survival and success.